The open meeting law requires that I notify the public that this meeting is being recorded. Therefore,
Recording in progress.
please be aware that an audio and visual recording of this meeting is being made by Boston City TV, a part of the City of Boston Office of Cable Communications, and it is being broadcast on Xfinity Channel 26, RCN Channel 13, and FiOS Channel 962, as well as live streamed on YouTube. Wes, take it away.
Good evening, everyone. This is Wes speaking. I hope everyone has had a good month so far. It's been warm weather, so we're lucky because summer is coming, and that's always nice to know. I wanted to go ahead and get started with our agenda so that we can get accomplished as much as we can. We're going to start off with introductions as we usually do, and I will go first. Again, my name is Wes Ireland. I am the board chair of this board, and I'm a male using sign language, and I will use sign language throughout the course of this meeting. I have two voice interpreters who will be voicing for me, and you might hear a female voice as well. So I will call on each board member in succession to identify yourself, please, or introduce yourself. According to my screen, what I see next is Olivia. Olivia, would you introduce yourself, please?
Sure, my name's Olivia Richard. I am a board member from Brighton. I use a manual wheelchair to get around.
This is Wes. Thank you for that, Olivia. I just realized, actually, that I didn't mention where I'm from and the region of Boston I live in, so I'm from the North End. And next I see Alice. Alice, would you introduce yourself, please? Alice, you are muted.
About that. Is that over?
Yes.
Okay, Alice Fisher, member of the board from the South End.
This is Wes. Thank you, Alice. Charlie, go ahead.
Hi, my name is Charlie Kim. I'm a resident of the North End, and I'm on the board representing parents and caregivers of children with disabilities.
Thank you, Charlie. It's great to see you. All right. Paul, why don't you go next?
Hi, my name is Paul Caron. I live in the West End, and I'm an advocate for mental health. Thank you.
Thank you, Paul. Richard, go ahead and introduce yourself, please.
Hi, everybody. Richard Gillespie. I live in Back Bay and member of the commission. And my most particular interest is mental health, children's mental health in particular.
Thanks, Richard. And Paulette, would you introduce yourself, please?
Good evening, everybody. My name is Paulette Durrett, and I live in the Mattapan section of Boston.
Thanks, Paulette. I also see Juan Carlos is with us, but maybe not on camera. Juan Carlos, would you introduce yourself, please?
Yes, hi, thank you, Wes. Hello, everyone. My name is Juan Carlos Ramirez, board member. I live in Boston South End. Some of my interests are adaptive sports.
Terrific. Thank you very much, Juan Carlos. Are there other board members, maybe somebody on the phone? Is a board member on the phone? Anybody who hasn't introduced themselves yet? Oh, Elizabeth just joined. We'll let Elizabeth come inside and then, hi, Elizabeth. We are just doing introductions. Do you mind introducing yourself, please?
I'm Elizabeth Jean Clower, Dorchester Advisory Board member.
This is Wes. Thank you very much, Elizabeth. And I would like to ask Commissioner McCosh to introduce yourself, please.
Thanks, Wes. Hi, everyone. I'm Krista McCosh, and I'm the Disability Commissioner and ADA Title II Coordinator for the City of Boston.
Thank you, Commissioner. I think that's everyone that I see on my screen, all of the board members that I'm aware of. Okay, so now because we have a quorum, right, we can go ahead and vote to approve the minutes from last month, which is the first item on our agenda. Does anyone have any questions or comments related to the minutes from last meeting as currently written? Okay, seeing none. Can someone make a motion, please, to have the board meeting minutes approved from the last meeting?
I make the motion.
Charlie, I see your hand. Sorry, the interpreter missed who just said that? Who said I make the motion?
Paulette.
Paulette. Oh, thank you. This is Wes. I think Paulette made the motion. So Charlie, you've got your hand up to second. Let's do that. All in favor, please raise your hand by saying, or excuse me, signify by raising your hand or saying aye.
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 Any opposed? So then the board meeting minutes from last month are passed as written. Thank you very much for that. And let's see where we are on our agenda. We will have a presentation this evening. And I have to say, before we welcome our presenter to the floor, that we are very lucky to have him here, the perfect timing. I would like to thank Kevin Simon, Dr. Kevin Simon, for coming and being with us this evening to talk about behavioral health. He is the first appointed Chief of Behavioral Health, the Chief Behavioral Health Officer, and he's been leading our community in the public health strategies around mental health, behavioral health, and we are very glad to have him here in front of the commission because we know that behavioral and mental health are an important need in our community. So Dr. Simon, please take it away.
Yep. Can everyone hear me? Awesome. And so one, thank you for joining and taking the time to meet with me and providing me space and opportunity to engage. And how long do I have?
Dr. Simon, about 10 minutes and then 5 for Q&A.
10 minutes to talk about mental health. Okay. Paulette, you know what I'm talking about. All right, so I'm going to share my screen. And for those who are on the board, you will be able to have access to a copy of this. I will send that to the commission staff after our presentation.
Sorry to interrupt, Dr. Simon. We're having a little trouble hearing you. Can you speak up or lean a little closer to your mic? Thank you so much.
Yes, I will move in closer to. So
Perfect.
I'm going to unshare my video so that way you're not just looking at my forehead. But I will now speak very loudly into the mic. Hopefully everyone can hear me.
Great.
Okay. So in terms of, to begin, my worldview and understanding of this topic, mental health, are shaped by my own experiences. I have implicit biases. We all actually have implicit biases in part because it's part of the human condition. But I do try to stay in a learning frame. And so it is not my intention to offend any person that is present here listening or looking. And in the event that I do, please let me know or let the commission know. So we'll do a brief introduction of myself, talk about the state of behavioral health as it relates to Boston and then also just nationally, and then look at the initiatives that we have going on in the mental and behavioral health space. So just from a background, this is my family. I share this because before I'm quote-unquote Dr. Simon, I'm somebody's little brother. This is my sister Michelle. This is Michelle, Natasha. We always are standing in the same orientation. This is me with my parents, Deacon Moclair Simon and Leedy Simon. They still live in the same house that we grew up in. This is my wife, Dr. Halford. She's an internist at Beth Israel. She says hello. These are our kids, Brooke, who's 5, and KJ, who's 3. That's my family, and so I like to orient people to the fact that I'm a normal person, like we all are, and it's actually what grounds me in terms of the work that we're trying to do. In terms of career trajectory, this is like a smattering of a CV on PowerPoint form. I went to an HBCU, Morgan State University in Baltimore. Went to Severian in Brooklyn, that's where I grew up. Medical school in the Midwest, SIU, did some research at Wisconsin. They have really good cheese curds in Wisconsin. Research at Pittsburgh. I did my adult psychiatry residency at Grady Hospital. Grady is the equivocal of Boston Medical Center here. It's the 5th largest public hospital that cares for a lot of individuals that have Medicaid, or in our state, we call it Mass Health. Then I came up to Boston Children's Hospital to get additional training in pediatric psychiatry as well as addiction medicine. So those are the 3 kind of doctors I am: adult psychiatrist, pediatric psychiatrist, and addiction medicine. And I do research as it relates to mental health services, trying to get individuals that classically do not get those services better access to said services. And you can see here a list of hospitals within the region that I have provided services at. So on any given day, I might be called one of these things. However, I most identify as a learner. In part, any space that I'm in, I have something to learn and people to learn from. So I love engaging with communities because the truth of the matter is we're only able to do what we can by learning from you. And nothing that I'm really saying is just of my own accord. I have a lot of mentors and sponsors. And so this is just a picture of some of them. Like our own Dr. Ojukutu, who's the commissioner for public health here, Monica Burrell, who used to be the commissioner for DPH, the Department of Public Health. I'm just acknowledging this is not just some pull yourself up, quote unquote, by your bootstraps. Truth is, I've had a lot of help and support. In terms of Mayor Wu, I met her 2 years ago, and she really had a question about, can I help Boston? And really, it's not really I, but can we help Boston? And so it really was about describing the state of behavioral health. And the reason I'm using behavioral health instead of just mental health, in policy world, behavioral health also encompasses substance use disorder like alcohol use or nicotine use. So just acknowledging that behavioral is to imply both the traditional psychiatric conditions that people might think about, generalized anxiety disorder, major depressive disorder, schizophrenia, bipolar, and so forth, as well as nicotine, alcohol, opioids, fentanyl, and so forth. We're going to pivot to thinking about behavioral health as it relates to youth. And so in terms of the data that you're going to see and I'm going to say is related to national data, and then I will highlight specific Boston-specific data. But 1 in 5 youth will have experienced a psychiatric condition within the past year. 1/3 of youth will experience a psychiatric disorder within their lifetime. Half of the conditions actually begin in early adolescence, and adolescence, just from a chronology standpoint, is when puberty starts. Yet less than half of children receive appropriate evidence-informed or evidence-based treatment and services. And so what ends up happening is you have almost a 10-year average delay between the onset of symptoms and then actual engagement in treatment. And again, that's the average. So there are individuals who are at 15 years between onset and treatment, or 20 years. And what does that look like locally? So I'm going to speak to my Boston Children's side. And we can see here, this is preceding the pandemic, that boarding, i.e. people who present to our hospital in the emergency room with a psychiatric concern, and there's need for like a psychiatric bed, yet the bed's not available because there aren't many beds available in our state. You can see that boarding was rising predating the pandemic and has only worsened since the pandemic. And there are a number of things that we're trying to do and think about locally about how to help our Boston youth. In terms of myself and why might I be a person that would be involved in this, I've taken time over the course of my career to think about and work with research teams looking at disparities of pediatric and behavioral health care, treatment of Black boys, opioid-involved overdose deaths, treatment of Black girls, adolescent substance use, mitigating systemic racism. So just acknowledging that I and a team have thought quite a bit about behavioral health for quite some time. And then in terms of what we're really talking about is the idea of social determinants of mental health. And I won't go through each one of these, but we know for sure that many parts of our community, there are families that don't experience just one of these boxes, but sometimes all of these boxes, right? So whether we're talking about, heat exposure in certain parts of our community that have less foliage, or we're talking about poverty or unequal access maybe to transportation, or ACEs, the built environment, homelessness, lower education. So all of these factors impact a person's mental health. So mental health really isn't just one thing. But when you have these negative social determinants, they lead to, reduced options, psychological stress, and then undoubtedly adverse health outcomes. So we have to think about upstream policies. And so the next slide that I'm going to hit is a short video of Mayor Wu highlighting some of the things that I'm then going to highlight after the brief video.
Need it right now. And we need that. Last year, we appointed the City of Boston's first ever Chief Behavioral Health Officer, Dr. Kevin Simone, and created a Center for Behavioral Health and Wellness at Boston Public Health Commission, led by Dr. Samara Gross. It's not just about those struggling with mental health, but for the many of us who love and care for people who are living with mental health challenges as well. We simply do not have enough mental health providers to meet our needs. In the coming weeks, we'll be announcing a partnership to train more and more community-based mental health workers in the field. A big portion of those will be clinicians, which we're also looking to train for non-clinical professionals in recovery. For 200 Boston residents pursuing careers in behavioral health, who can be trained in neighborhoods across the city, to program develop LGBTQ+ community, integrate and concern for marginalized. When we talk about wraparound support towards the government, addressing the issues at every level, specialized care to the people our kids interact with every day, how we talk about this problem in class. We're donation advocates for our kids in healthcare here in Boston, and help care extend to mental health.
So you heard her reference the Center for Behavioral Health and Wellness, and I like to think of the center as a think tank/do tank, in that it exists within BPHC, which itself is made up of several bureaus, including our emergency medical services, like when folks call 911, recovery services, homeless services bureau, community initiatives, and then we also collaborate with, obviously, the city, like Boston Public Schools, Boston Public Library, and I highlight in Boston Police Department, I highlight the library in that we now have clinical social workers available at the Copley Library, because persons who are unhoused, who may actually benefit from applying for disability services like DDS, or DMH services, Department of Mental Health. Librarians are not necessarily equipped with helping that person navigate how to fill that application out, but our clinical social workers are, and so they've been, we've seen usage, and we're going to expand that to other of our libraries. In reference to the initiatives that the mayor described in the video, last month we acknowledged a $21 million initiative to support students with regards to behavioral health. And how are we going to do that? I'm going to highlight some of those initiatives in the next few slides. So we've done community health needs assessment, community health implementation plans, and the community health needs assessment highlighted these three things as most concerning to constituents within the realm of behavioral health as it relates to youth. So one, increasing the workforce, widening public awareness, and then also attempting to provide youth with pro-social activities. So in terms of the increasing the number of diverse behavioral health workforce, you heard her acknowledge 200 Boston residents will be supported in their pursuit of behavioral health careers. That is through a $5 million funding opportunity that was awarded to UMass Boston. And so UMass Boston currently will support 200 Boston residents over the next 2.5 years in relationship to peer mentorship, licensed clinical counselors, recovery coaches, and that support is to mitigate the costs related to pursuing a behavioral health career. So that's one example of the workforce, and some of those individuals will then go on to work at our Boston Public Schools. Another thing that we acknowledged was widening public awareness of the behavioral health resources that we do have. And so one of the things that we recently did is actually publish our first Health of Boston mental health report, which is freely available. If you type just that, Health of Boston mental health report, it will pop up. And for instance, here is an example of things that we're identifying. So this is with regards to Boston Public High School students over the last several years. And you can see this is about persistent sadness has gone up. And so I, in terms of the public awareness, talk at a lot of places. Sometimes you have to get our, fan favorite Jason Tatum to think about mental health. Or my wife catches me on TV talking about mental health. Or we talk to the DEA in terms of continuing access to virtual services. And we did put out a public health campaign, and PowerPoint is apparently on its own schedule, so forgive me. We put out a behavioral health campaign that is actively underway, and there are focus groups being had in reference to how is it that we can best ensure that constituents all across our beautiful city are aware of the resources that are available. And then in reference to providing youth with engaging pro-social activities, we do have a youth advisory board within the commission, and these are some of the youth on that advisory board. These are BPHC staffers. But they wanted to form a podcast. So we have a podcast called Break the Line, where they can interview city officials about any number of activities. So would encourage you to download and subscribe to Break the Line so that the youth can recognize that they are making an impact. And we had a recent, someone's trying to enter. We had a recent RFP that is about trauma-informed school system transformation, and we're waiting for PowerPoint to meet with us, where we're going to be partnering with 10 BPS schools to try to change what we might call like the ecosystem of the school, such that not just the students, but the staff within the school feel better supported in thinking about how to best support themselves, let alone the students. And for whatever reason, my computer is not moving forward, so you're just looking at the interview that I had. And so that award was with Flourish Agenda, and so they'll start to work with the 10 BPS schools over the course of the summer, and then over the next year and a half. I'd like to move forward, but seemingly, there you go. So that's the trauma-informed school transformation. I started with family. I'm recognizing time. So I'm going to end with family. So this is my dad, Deacon Mokhtar Simon. And a month into my role, he wrote me a letter, which I'll gladly read to you all. Baby K, peace be unto you and your household. As I reflect on the accomplishments for the past few years, I want to tell you how proud I am of you. Since you're in a new position, and I do try to hold to this, I beg you to always be nice to people you come in contact with. Be considerate, do your work with transparency, and keep your integrity until you go down to your grave. I've seen people losing all they worked for in their life for stupid things they do at their work. Love your children and your wife as you love yourself, and the Lord, who knows the heart of all, will reward you. So I try to heed my dad's advice and do work with being transparent. And so I'm Dr. Simon, your Chief Behavioral Health Officer for the city. But literally, I just saw in that letter, people in my household still call me Baby K. So I'll stop sharing and open this up for conversation or questions, I believe. And then I'll also turn my camera on. Olivia?
Excellent. This is Wesley here, and I'm going to call on each person if they need a question. I have Olivia and Paulette. If you can go first, Olivia.
Yes, this is Olivia Richard. Is there an effort made, A, to include disability as one of the diversity needs for the targeted funding for creating new behavioral health providers? And also, are there efforts being made with Boston Youth and Families that are not school system based? We know that there are youth that are not involved in the school systems. Either they go to private schools, charter schools, 766, etc.
Yeah, so two great questions, Olivia. I believe the first one was regarding to ensuring that persons that have or experience disabilities are eligible in reference to the behavioral health workforce. So within the RFP, it was explicitly stated that diverse populations, including those with disabilities, be included as potential recipients for the vendor. In this case, it would be UMass Boston. So that population is included for the workforce. And in reference to the schools, our first effort is with BPS, but that's not to say that's our last effort. It's just the first one that I'm referencing. So in terms of the other school systems, and then yes, in terms of capturing students that perhaps are not attending BPS for any number of reasons, we do have efforts across the city, not just with BKC, at trying to reach larger groups.
Excellent. Thank you. We'll move on to Charlie. You can ask your question.
Thank you. Dr. Simon, thanks for the presentation. That was really great and informative. In relation to the actual, I think the number you stated, because I remember when this was announced, it's pretty exciting. It was a $21 million allocation specifically for youth. And then is that a multi-year? Because I know that you mentioned that UMass was granted the first tranche, but is that just over this fiscal year, or is that multi-year? And then if so, what I only saw presented was like about $12 million. Where is the other 9 being? Are you able to kind of speak to that? Because on the perspective of youth and students, just wondering how is that actually getting down to them, right? When are they going to see these programs, and if it is falling under 1 year, but if it's multi-year, that's great too.
Yeah, no, so it's a good question, Charlie. So the funds are in relationship to ARPA, and so the 21 million is out until 2026, so not just this year. And then, again, I happen to only share the first few RFPs that have been awarded, and so there are other dollars that will be awarded. So for instance, an example of this is within the commission, we have a BAHEC, the Boston Health Education Center. BAHEC is already an internal program that we're putting some funds toward expanding the number of youth that can participate in BAHEC. Another avenue towards some of the funds is in reference to EMS, which is not just youth specific. So in reference to, there are more dollars to be allocated, and it's not just for one fiscal.
Now I'm going to call on Paulette for your question.
Good evening, Dr. Simon. My name is Paulette Durrett, and I'm interested in the focus groups and who's conducting them and how they were recruited to conduct the focus groups.
Yeah, no, it's a great question. So the vendor that is awarded the public mental health campaign is called Think Argus. Think Argus. And Think Argus, in terms of the focus groups, they surveyed the commission-wide who are the communities and who are the nonprofit organizations that we should be engaged, or I guess they should be engaged with in terms of attempting to have focus groups. And so it's Think Argus is the vendor, and across our commission, we provided, or individuals provided, the names of a variety of individual stakeholders, nonprofit organization stakeholders, community centers, churches. So that was the process.
This is Wesley signing here. I did type my question in the chat. I don't know if you have announced any other or who the 10 schools are for Boston Public Schools. Is that publicly available? Can it be shared?
Yeah, so just not to forget any, I'm not going to pretend like I've memorized all 10, but that is publicly available, and we can get you to that list for sure.
Excellent. Thank you very much for your presentation, Dr. Simon. I'm going to ask the other board members if they have any questions or comments at this time. All right. Thank you very much again for your presentation, Dr. Simon. We can always follow up with you on Twitter or Instagram if there's any further questions at a later time.
Yeah, that is true. And thank you all for providing me the space to be engaged here. And I hope you all have the rest of the beautiful evening.
Thank you. Take care. And this is Wesley here. We're going to continue with the board meeting agenda.
Oh, well, funnily enough, it is the chair's report, so it's my turn to present. Let me just pull that up. Hang on just 1 second so I have it in front of me. Okay. So for my chair's report this evening, I have 2 items that I wanted to share with the board and with the public regarding the statewide captioning bill letter that the advisory board approved and sent to specific legislators last month. I was able to meet with State Senator Michael Barrett's aide to figure out why his office had one version of the legislative bill that differs from the other bill that is more similar to the City of Boston's captioning ordinance. So I finally found out the reason why the quote-unquote patron asking upon request phrasing was mentioned, that patrons would ask to turn the captions on, and why that was part of Senator Barrett's Senate bill version. He raised concerns about the level of compliance of Boston businesses, so his team literally went out to a number of establishments in the City of Boston to see how many had closed captioning enabled on their TVs. Of the Boston establishments they visited, a little more than 50% had closed captioning enabled on their TVs. So his team's finding was just a small number, just 11 establishments in the downtown and Fenway neighborhoods. So of those 11, 6 had closed captioning enabled on their TVs. From Senator Barrett's view, he found this compliance rate to be quite low. And his concern is that it would be even lower if this was extended statewide. In my opinion, I'm glad to see that at least half of these businesses are complying to this law. I think the concern with the city ordinance does not include any fines as compared to other cities nationwide, and this is probably why some don't really follow this ordinance. I would suggest either an amendment to this ordinance to add a fine, or include another city department to ensure that businesses comply with this. I know that this has been passed since the end of 2022, and this is somewhat challenging, and I suggest the Disability Commission take further action on next steps to improve its compliance. Also, we need to find a way to gather data on this. That is the first item I wanted to discuss. The second part of my report mentions, and a part of Commissioner McCosh's report last month, on the City Council's consideration to add handicapped parking permits for pregnant women. I would like to ask the advisory board for feedback regarding this at next month's meeting. We do not expect the City Council to pass any ordinance regarding this, as they are wrapping up their fiscal year budgets, and a new fiscal year starts in July. And it's very likely that this topic will come up in the City Council on that month. So I would like to ask everyone on the advisory board to prepare your thoughts and concerns and bring this up at next month's meeting so we can prepare our statement of where we stand, or send a letter to the city councilors on our position in this possible movement. So that concludes my report. I'd like to open up the floor to questions and comments from board members. I see several hands. Zeri, yours was first, and then we'll have Charlie. Go ahead, Zeri.
Thank you very much, Liz. So my question is about, actually it's not a question, more of a comment. When we refer to physical accessibility, one of the things that I'd like to recommend is that we refrain from using the word handicap parking, handicap bathroom.
Oh, you're right. Of course, you're right. Thank you. Yes, I know better. Absolutely. I just hadn't figured out the correct terminology. Thank you for the parking spaces, et cetera. Yes, no, you're right. I appreciate that. So, right, physically accessible? Right, okay.
Yeah, you can just say accessible. Yeah.
Okay, great.
And then the second comment is, I don't know if you already talked about our community session last week with the mayors, with the community. I guess my concern was, again, this is coming from an awareness background of making sure that when we have a public meeting in person and hybrid, that we actually do a personal description of ourselves, because we have many blind constituents who may not be able to see us. And so I think a visual description should be part of the culture when we do hybrid Zoom meetings. And it's not really that difficult. I mean, it's like pronouns. You know, I describe myself as tree hair, short hair, dark, brown hair, woman who's being seated on a wheelchair. So it doesn't have to be that elaborate, but just something that would be respectful of making that accessible fully, making the environment fully accessible.
This is Wes. Thank you, Zeri. Appreciate that. Fantastic comments, well received. And I think we will add physical visual descriptions to ourselves going forward. I do mention in my introduction every time that I'm signing that I'm a male using sign language and that I use primarily female sign language interpreters, so that's the voice that you'll hear. But I think beyond just saying Wes here signing, the people who, like you said, don't have visual access to me, who can't follow the conversation necessarily with just that description, it might be useful to add that visual description as well. So next month at our meeting, I will remind everyone to include not only their name and what part of Boston they're from, but also a visual description. So thank you very much for that suggestion. And just reading something in the chat. And okay, Charlie, I see your hand is raised. Please go ahead.
Yeah, I think this may be a question in response to when you were talking about us gathering our thoughts and then potentially writing a letter or something to the city council. This question probably is for Commissioner. Are we able just to, I wouldn't say summons, but are we able to respectfully call a city councilor to come and kind of discuss with us? Because it's difficult for me to try to formulate any opinions around something that I'm not exactly sure where to find the information and the discussion about this particular matter. That if Wes is saying that it's going to come up in city council.
Yeah, so thank you for that question. The city has an intergovernmental relations office that functions as a liaison between city departments and the city council. So our office doesn't directly interact with the city council because we work for the mayor, and separation of government, that's the legislative branch. So we work in the executive branch, so to speak, for the mayor. And so we would have to go through our intergovernmental relations office. We try to see if we would get a city councilor to come to a meeting or to have a meeting with board members. That's something that we can look into if you did have more questions.
Yeah, thank you. I just wanted to bring that up as a question. I don't have any strong thoughts on it. I just if the request from Chair West is that we are to do that, I just would like to somehow get additional information or some guidance on where the right information is or the complete amount of information, so I can formulate an opinion that would be productive to contribute.
Okay. We did share the hearing order with everybody, and Andrew and I were able to meet with the city councilor's staff, the city council himself and his staff. So we do have more information that we could share, but if you had direct questions, things like that, we can certainly look into that.
This is Wes. Thank you, Commissioner McCosh. Would you mind sharing that information with the board members, maybe in advance of the next meeting next month? That would be helpful.
Sure.
Terrific. Thank you. All right. Any other questions or comments related to the chair's report?
I did have a comment, Wes, on your...
Please.
Yep. So talking about the captions ordinance, I know that you are thinking that compliance is an issue, and I think that you're right. We discussed this internally a little bit and, amongst our staff, and we didn't think that just over half the restaurants being compliant on on a whim of investigation was that terrible, because we haven't done a lot of outreach on the program, and so it's not great, but we didn't think it was the worst thing in the world. But it does speak to the need for more outreach to be done to get compliance numbers up. But I think that the first step would be our outreach and training and providing more information to restaurants, rather than going directly to proposing any sort of fine system. There's a lot of complications when it comes to proposing a fine. When we started working on this ordinance, one of the biggest reasons that we got so much buy-in from city departments was because we were not going to be proposing any sort of fine. In fact, our office wouldn't be able to take any kind of fine money, so it wouldn't be something that we could really process. It would be a very complicated structure that we would have to work out. And there are other ways that we can work on enforcement. Like we talked about outreach, we talked about writing letters to let people know. And I know Andrea has written some letters to some businesses that we found that weren't in compliance. And typically we get a good response from them. Usually it's just a matter of raising awareness. And then we also work with the city's licensing board, which licenses certain businesses in the city, restaurants, to have a TV. And we can always go down that road of potentially calling businesses in for a hearing if they aren't compliant with the ordinance after so many notifications. But I think there are a lot of steps that we can take before we go immediately to a fine, because like I said, it's going to be a complicated structure to set up. It's not something that our office could process, and I don't think there'd be a big appetite in City Hall to propose something like that.
This is Wes. I appreciate that. Thank you, Commissioner, for that context. I think the fine would be the last resort. I think we can keep it on the back burner until we need it, and that's probably a good use of that option. But I think maybe what we're noticing so far is that things have been a bit passive, and so we can be more assertive in outreach. And I know that there are other cities that are working with a fine structure, so the research that I've done shows that, and I think it can be effective. But we can certainly put other ideas on the table, other solutions, and I'm very happy to talk to anybody about this offline. Charlie, I think your hand is up. Is it still up? Did you have more to say? And then I see Jerry as well.
Yeah, I did have another comment, not on the other, but on this component. I know that compliance, and I know that your passion towards this is, as we've spoken offline. I just thought maybe to kind of tie in what I brought in last week about goals, maybe as part of since we are part of the advisory board, we could think about maybe seeing how we can collaborate with the Disabilities Commissioner, Andrea and the group, to think about how we can move towards a better number, right? Because I think what the Commissioner was saying, there's an initial kind of pool that was, or poll that was out there. Maybe we set goals for, a long term, like next year, the year after, of what that number of compliance is, and we collaboratively work with the Commission to figure out how that outreach happens, and maybe we hold the Commission accountable for how that plan gets executed when it comes to outreach awareness, because I think it is something that seems to be, that it has to be broad outreach, and there's a lot of follow-up and all that. I think it's going to take a lot of meaningful thought into figuring out a good strategy to get to a number that we all agree is, as a collective board, that we would agree is acceptable and amenable to meet what you that you would like to see.
And can I just add that was one thing I meant to mention as well. Wes, you had mentioned the survey of some sort of businesses. And I know Andrea has something in the works. I don't know if there's anything that she wants to talk about right now, but we have been talking about some sort of survey.
Andrea, sure, go ahead.
Thanks, Commish. Hot off the presses after our conversation, Wes, where you mentioned that sort of informal survey. It looks like we will have something done certainly within the next fiscal year, so by June of next year. We're still working out how big it will be, how much money we have to hire folks who can actually go and see for themselves, and how we're going to select to make sure that we have a representative sample across the city and that kind of thing. So very early stages, but yes, we will have a survey done certainly by the end of June next year.
This is Wes. Great. Thank you for that information, Commissioner and Andrea. Jerry, I see your hand up. Go ahead.
Thank you, Wes. And this is Jerry. And forgive me, but I may have come in a little late or didn't hear. Did the issue of the compliance, did that come up from your meeting with a state senator? And was he?
It did. Yep, that's where it came from.
Was he not moving forward with statewide legislation because he thought that Boston compliance wasn't high enough? Is that what the context is?
This is Wes. Sure, Jerry, I can catch you up. I don't know where the bill stands at the moment, but I have a feeling that he's waiting to see how the city of Boston can improve compliance before he would recommend it to be statewide. So fingers crossed we can get some dents, we can make some progress, and that will affect whether he perceives it statewide.
Sure. And in terms of the accessible parking for, or potential accessible parking for pregnant women, are you saying that there's going to be a hearing on that issue?
This is Wes. I believe that this was previously discussed and that we, maybe somebody else has more information?
Sure. Sorry, I saw Andrew to jump in.
Commissioner.
We did meet with the counselor, and he is still interested in having a hearing. We did emphasize that we believe that the hearing should be more focused on information sharing and raising awareness that women who are pregnant and have a disability can already apply for the placard, rather than creating some new category, which would have to happen at the state level anyway. So I believe the counselor's intention is to hold a hearing, but I don't think it would be any time in the next few months. So we will definitely keep an eye on it and let the board know when we hear of anything that's being scheduled.
Yes, thank you, Commissioner, for weighing in, because I thought in your report last month you had said that. So I was a little bit confused by your report, Wes. But thank you for the clarification, and thank you for your hard work, especially around the captioning ordinance and pushing that to the statewide level. And I'm sure that the advisory board will look to support that. And I think Charlie's idea of working with the commission and city staff to really to think about, like, okay, so we have 50% compliance, or we have the small number of people that establishments that we've surveyed. What are some target goals that we want going forward? I think that would be good work for the our advisory board and the commission to work on together. So.
And hi, this is Kristen. Just to add one other thing, Andrew put in the chat, I don't know if everybody saw it, but our office does have business cards. They're like a wallet-sized card with information about the ordinance. So anyone who wants to take some, we could send some out to people, and you can give them out to restaurant staff. If you come across a place that doesn't have captions on, this just explains the requirements. And then you don't have to actually make a complaint or make a request even, you could just hand out the card.
This is Wes. Thank you, Commissioner McCosh. I appreciate that. The one idea that I may have, which I don't know what other people are going to think about this, going into places and asking for the manager, maybe that business card could be taped on the door before the business is open, in the same way that their licensure is put in the doorway or in the window. That's just one idea of a way to make it more permanent reminder. Okay. So I believe that is the end of the questions and comments regarding the chair's report. I'd like to thank everyone for your attention. I'm pretty sure I've lost the agenda because I closed that window by accident, so I can no longer see it, but I think the commissioner's report might be next, so why don't we go with that?
Yep, you're right. Thanks, Wes. So we'll pull up my slides. And my report will be fairly brief tonight because I was on vacation for 10 days, so I just got back Monday. So I will have a more brief report tonight. So I will start off by talking about some Disability Commission events. As you all know, we had the Disability Community Forum 2 weeks ago, and I want to thank the advisory board members who were able to attend. I really appreciate your presence in the community and having community members have the opportunity to be able to see you and learn about your work, so that was very much appreciated. We had nearly 100 people in the disability community who participated through Zoom and on person. That probably includes some city staff, but it's really great that we are able to get so much support internally to have staff come out, because it's a really great chance for people in the disability community to meet other staff members besides people from our office and ask questions and get to know who they can reach out to if they do have questions moving forward. So we were happy with the turnout, and we got some really great questions. Every year after the forum, we send out a document with the questions, all the questions that were asked, along with answers, so that people who weren't able to attend can see what we discussed. And then if anybody missed any answers that we had given, it's all in one document. So we're working on that now, and we plan to get that out hopefully by the end of the month. Also at the forum, I presented our 2023 annual report. It summarized the work of our department and of the advisory board. So if you didn't get a chance to get a paper copy, if you were there in person, there's a link in the slide deck so you can see all the work that we did over the past year. And then finally, the community forum is now available on our YouTube channel at the link provided on the screen. Next event that we have coming up is ADA Day 2024. This will be on Wednesday, July 17th from 12 noon to 2 p.m. at City Hall Plaza. I believe most of you have attended in the past. It's a really fun celebration of the anniversary of the ADA being passed. We always have a resource fair we're shooting for 30 disability organizations and city departments this year. We had put in for a larger tent, so we'll have more space for shelter from sun and rain. So hopefully we can have more tables and more organizations attend. So we really like to try to offer the opportunity for people with disabilities to connect with services and resources that they may not know about, and also with city departments. So we're excited about that. This year we're going to be recognizing the Department of Innovation and Technology in the City of Boston, known as Do It internally, and we're going to be recognizing them for all their work on digital access for the city. We're currently in the beginning stages of talking about a digital accessibility plan for the whole city, now that the federal government has given some guidelines on digital access requirements of municipal governments. So we're looking at that, and then also launching our disability data standardization guidelines over the next few weeks and the next month or two. So save that date. I hope you can all attend. And then next slide is just some City of Boston events. I had these on my report last month, but just to let you know that the Mayor's Neighborhood Coffee Hours are continuing. They'll be going through June 26th. There are none this week because the mayor is out of the country. She's at the Vatican with Governor Healy, so she won't be doing any events locally, but they will pick back up when she returns. So the coffee hours are a really great opportunity to get to meet the mayor, meet city staff, and raise your concerns. It's a direct link to the mayor and the administration, so if you're available, please check out the schedule. It can be found at the link in the slide deck where it says Mayor's Neighborhood Coffee Hours, and hopefully they'll be in a park near you. Also, Boston is doing Open Streets again this year. The first one was held last weekend in Dorchester, but we have a few more coming up throughout the summer from June through October. And these are half-day events that close off a street and allow businesses and community agencies and families to come and, have a closed street, make space for music and games and cycling and tabling with information. So if anyone hasn't been to one, I'd recommend it. They're really great community events. And we do work closely with the different city departments who run these events to ensure that we have access at every Open Streets event. Next slide. So then just some general updates on our department work. As I mentioned a few minutes ago, we have completed the final draft of our disability data standardization project. So this is going to create a policy on when, how, and why city departments will collect data on disability. And what we found from the focus groups and our discussions and looking at literature review and national trends, what we really heard loud and clear was that people with disabilities would rather talk about the accommodations they need rather than their actual disability, like diagnosis or identity. So moving forward, we're going to be directing city departments not to ask if somebody is blind or deaf or has a mobility impairment, but rather what accommodations do they typically need? Like, do you usually use a screen reader, or do you usually need an ASL interpreter? This is for two reasons. We feel like it's more respectful and less invasive of asking information of people with disabilities. We don't really need to know anything that we don't need to know. So what would be helpful for us is to know about accommodations more than what their actual disability is. And if we collect data on accommodations, that will help us figure out like what funding we may need. Like, if we get a lot of feedback that people use ASL interpreters, it would make a good case for us to get more funding to make sure we provide interpreters. If we see, not that many people usually use Braille, it may, for us to look at like audio descriptions or, audio recordings and things like that when Braille isn't really used that much. So we don't know what we'll find out, but that is going to be the guidance that we'll provide to city departments moving forward, is to ask data on accommodations rather than the actual disability. The next bullet talks about an RFP we have out to hire a consultant to update the City of Boston's ADA transition plan. We did an initial transition plan in 1993 when it was required, when the ADA was passed. It's a very old plan now, so we want to update it. It doesn't mean that the work hasn't been done. The city's done a ton of work on accessibility upgrades since 1993. It just means that we don't have it all located in one central place. So this consultant will kind of pull together all the buildings and facilities assessments that have been done, communication, accommodations and services that we have, and programs and policies, things like that we consider part of the city's accessible plan under the ADA. So things like the digital accessibility plan I mentioned, that could be part of this. It will probably be a web page on the city website, and it will just be kind of like a dashboard where you can go and see all the accessibility improvements that the city has made over the last 30 years and where we stand today. So we're excited about that. An update on training. We have a training specialist who's been here not quite 1 year, and they have done so far 15 trainings since coming on board. They're currently working on recording some evergreen trainings on important announcements in American Sign Language. So this would be something like a heat emergency or a snow emergency or schools closed. So those things can be very general announcements, but we can release them to the public when we have something like that arise. It doesn't necessarily have to say dates and times, but the message will be in ASL so that people in the deaf community who use ASL will get the information in their native language. So that is going to be a big piece of our training specialist work, so we're excited about that. They've also given, some of the 15 trainings they've given have been on various topics, including neurodiversity, interacting with people who have disabilities, kind of like a disability 101, also an accessibility 101 for some patients at Spalding who are newly disabled and just trying to figure out what access means, what their rights are, what services that the city provides as far as parking and other things like that. So that was an accessibility 101. They've also developed a training on service animals. And on that note, I did want to mention that a lot of you may have seen in the news that there was an incident recently in Chinatown where a customer was denied entry to a restaurant because they had a service dog. So things like that aren't directly under our control because we work on ADA Title II, which is access to local government services, whereas restaurants would fall under ADA Title III. But if you remember last month when I talked about our work plan for 2024, one of the things that we are kind of branching out to right now is ADA Title III to ensure that the City of Boston, other than the government, is also accessible as it can be. So in instances like this, I will write a letter to a restaurant and just say, reminding them of their responsibilities and requirements of the ADA to allow people with service dogs into their business. So it was a disturbing article, and we don't like to hear those. Unfortunately, we do hear complaints about service animals, so being denied. So our training specialist was already working on a training about service animals, but that's something that we hope to, get out widely, and it will also be recorded on our webpage, so we can always refer businesses to that training. So we're excited about that. And then finally, we testified in front of the Boston City Council on April 25th to present our department's proposed budget for FY25, and that runs from July 1st through June 30th of next year. So we feel good about our budget, and we feel very supported by the Equity and Inclusion Cabinet and Mayor Wu. So we're hoping, fingers crossed, that that will be seamless and it will be approved and we'll be good to go. And then the last slide is just, again, I left this in from last month in case anyone was interested. I know the executive committee had mentioned before that they'd like to know our plans for work that's coming up rather than just reporting on it after it's already been done. So rather than summarizing everything we've done, this is looking ahead to what we plan to do for the rest of this year through next June 30th. So again, our main task and responsibility is ADA Title II. So again, working on the transition plan, trainings that I just mentioned, and increasing access systemically through checklists and language blurbs and resources to other city departments. ADA Title III, again, this is more broadly improving access across the city. So outreach and enforcement on the captions ordinance, like we talked about, training on free and low-cost barrier removal for small businesses, and we're going to work with Main Streets on that. And then, again, sending notifications of requirements. We call it a Do the Right Thing letter. That's a letter that I can write to businesses when we get a complaint of non-compliance. And then finally, we are working on financial empowerment and economic mobility of people with disabilities. We know this is a really tough one because people with disabilities are often limited in their income and savings, and there are a lot of disincentives to work. And work is one of the best ways to improve your economic mobility. So some things we're working on is the return of Disability Mentoring Day in Boston City Hall with Mass Rehab Commission, now known as Massability. That will be a day where we bring in Boston residents who are seeking jobs, and they'll get some mentoring from different city departments and a session with the Human Resources Office where they can actually apply for a job. We also host webinars on employment in October during Disability Employment Awareness Month. So this year, we've for the last few years, we've done one on getting a job with the City of Boston, kind of demystifying the process. This year, we hope to expand it to do maybe 2 or 3 webinars, one on saving and banking with a disability and one on housing. And then we are also talking about hosting an interview or hiring event for qualified job residents, Boston residents who are disabled. So it'll be like a one-day event where people with disabilities can come in and meet hiring managers and actually apply for jobs on the spot. So it can be a great way to connect people directly with hiring managers, and they can have a chance to apply directly for a job, and that will be another way to break down a barrier to employment, because sometimes just getting that first interview is a real barrier. So if we can kind of remove that piece of it, then hopefully it will lead to more people with disabilities getting hired by the city. And that is the end of my report, but I'm happy to take questions if anyone has any.
This is Wesley here signing, and I'm looking across the Zoom room. Oh, we've got a question. Elizabeth, would you like to go ahead and ask your question?
Thanks, Commissioner. I just had a couple of quick questions about, a question and a comment for ADA Day. That's great to hear that there'll be a larger tent. I think that will be helpful both for the vendors and for seeking shelter if it's a hot day. I don't know how much ahead the t-shirts are ordered or were ordered, but it seemed like some of the sizes, like large, 1XL, but it seemed like they either had the very small sizes or like 2+ or whatever. They seem, the middle sizes seem to run out more quickly. So I just thought I'd mention that.
Yeah, we can definitely make note of that. We're always trying to ballpark what we need the most of, so we have definitely rearranged the size quantities in the last few years, but we can definitely keep that comment in mind when we do order the t-shirts. Thank you.
Wesley here again. To add to Elizabeth's comment about ADA Day, if it is a hot day, it is a concern for me. I'm sure it is for most of you. I would suggest that the tent add fans or some kind of cooling mechanism like mist that can be spewed out. Those are another suggestions that I wanted to add.
Yeah, thanks, Wes. I know that the one city department does give out like cooling kits that have like mister to it, so we can definitely look into that. And the MBTA always brings a bus every year, a cooling bus, so people can seek shelter inside the bus if necessary. And one year we actually did cancel it, not last year, the year before. We postponed it a couple weeks because of the heat. It was like in the middle of a heat wave, and we didn't want to subject people to that. So we definitely are always keeping tabs on the weather. But that is a great idea about like a misting fan.
Excellent, thank you. And Zeri, did you have a comment?
Good question. For the ADA Day, I wonder if, I know I've seen the MBTA buses showcasing like the left, but we wanted to do a table this year from MGB, and one of the things that we wanted to find out was whether we could actually have one of our community health plans on the plaza. Is there any kind of paperwork that we need to get permission for before we, tell them that they can come in and participate?
Yeah, why don't you follow up with our office? We do have a number of vehicles. It's just a matter of like making sure we have enough space, because we do have like an emergency EMS ambulance. We have the MBTA bus. We have like the food vendors sometimes, the radio station. But yeah, we'd be happy to look into it. Just follow up with me directly and we can see what we can figure out.
Beautiful, thanks.
This is Wesley here. Are there any other questions or comments for the commissioner's report? Seeing none, thank you for the report, Commissioner McCosh. And I'm sorry, Elizabeth, your hand is still raised, or did you have another comment?
No other comment, thanks.
Okay. I'll move forward with the agenda now. Next up is announcements. Does anyone have any announcements that they'd like to share with us? Seems like there are no announcements. We'll move on to old business. Does anyone have any items that are needing to be brought up?
I don't know how my thumbs up showed up. That's weird. I don't think I did that. Charlie, I see your hand. Go ahead.
Oh, thank you. I was just, I think we have it as running old business, but Commissioner, I know that the Boston Public Schools Transportation is supposed to give you, I believe, a quarterly update. I didn't know if they had missed the last one. If there was any updates from them as we are going into year end, but I think the biggest thing that parents going into the summer, there's two main things that they do get anxiety over is summer programming for their kids, right? Especially the kids with disabilities, that what is available. But there is in the school system, it's called extended school year, and that requires transportation. So Boston Public Schools, yellow buses. And because it's such a truncated period, they have to negotiate everything. I was wondering if you had any updates of that, because that's always been a sore spot for parents, because it takes, by the time they figure out the routes, that summer extended year is basically winding down, right? And so kids miss programming in the beginning.
Yeah, no, that's a very important point. Usually I would reach out to BPS to get that data. I have not reached out. I think the last time we got the data was February.
This is Andrea. What they offered actually was not quarterly, it was 3 times a year, end of the school year, end of the summer, and then December. So we can reach out. They're usually pretty responsive and pretty proactive, but because the school year still has a couple more weeks in it, we haven't gotten those numbers yet.
Oh, okay, so just a clarification, Andrea, sorry. The 3 points were end of school year, end of summer, and end of December then?
Yes.
Is that correct? Did they give it any explanation or rationale around why those specific times and periods? Is that like a period of great data reconciliation or a data epiphany or anything like that?
They didn't provide a detailed description, but my understanding was at the sort of natural points of the school year, right? Beginning of the school year, looking back at the summer, December, looking back at the first kind of semester, and then end of the second semester was my understanding of the thinking, but they didn't send me a great deal of explanation. They were like, these are the 3 times it makes sense to us. What do you think? And it made sense to us at the time, but if there's a different timeline that makes sense to you, let me know.
No, thanks for the explanation and clarification.
This is Wes. I have a follow-up question, actually. I'm assuming that the next time we will have more information, maybe by the month of July. Will we have more information by then? The end of the school year will have happened?
Do we not have a June meeting? We should have an update for you in June. Is June the month we're skipping?
Right, well, I don't know, I didn't know when the school year ended. I guess that was my question. So I was assuming that the information would be ready by July.
We may be able to get an update by June. Let me look at when we meet next.
Okay. Great, thank you, Andrea. Any other old business? Okay, we'll move on to new business. I actually, as chair, have an item I wanted to discuss for new business. And I'm just pulling that up. So, per state law, per state law, the Commission Advisory Board meetings have to occur at least 10 times a year. And for the 10 times a calendar year. For the 2024 calendar year, we have a total of 11 meetings with a combined November and December meeting scheduled for early December. And that means that we can cancel one meeting because we have to have 10. We are allowed to cancel one because we're up to 11. And so I would like to propose that with summer coming, that we go ahead and cancel one of our summer meetings. I was thinking of August, so I wanted to see how the board members would feel about that. I wouldn't go ahead and cancel that meeting without getting input from others, but I wanted to put that to the board and see what folks think about canceling August. Charlie, I see your hand.
Hi. Yes, so I did want to kind of tie this into then one of my questions that I had previous. I know that there's a statute saying 10. We have 11. I would just like to understand the work, right, that we're trying to achieve this year, right? And that ties into what is this board trying to have as goals, for the year. So for me to just meet a statute or say, hey, let's remove a meeting, without knowing what our work should be, or if we set out any goals. We did set out goals. I would probably propose maybe we should meet all 12 months, or do more than the statute, right? If we did have that, and I just bring that up to everybody is this question that I'm bringing up is if it's just going to be reports, and not just, they're very important. The meetings, we do have very important discussions. However, without us setting or collaborating to get what type of work we want to get done for 2024, it would be hard for me just to kind of say, should we just hit 10, right, versus keeping the 11. So sorry to make it more difficult for you, Wes. I think it's just, I'm just trying to really, get that point across.
This is Wes. I appreciate that, Charlie. Thank you for that comment. I'm wondering what other board members have to say. What do other people think about that? Any questions or concerns? What are their thoughts? And I see Paulette. Go ahead, Paulette.
So I agree with the elimination of August. I think that, as you can see tonight, our attendance is down a little bit, and I think that by August, people might just need a break. And rather than us waiting around and hoping that we get a quorum, that we just plan the work that we have to do. August is going to be a month that you're free, but then we hit the ground running again in September. So I agree with the elimination of the August month.
Okay. Great. Thanks very much, Paulette. Yeah, I'm in the same boat as you, so I think my opinion is clear. Olivia, go ahead.
Sorry, it took me a minute to unmute myself. This is Olivia. I don't think we should cancel a meeting for the sake of canceling a meeting. I think we should keep it in case something happens later on as a buffer, particularly November, December. And if we go back to in-person meetings in September, as was proposed over the email chain, I think we should keep a safety net there.
This is Wes. Thanks, Olivia. Any other comments or thoughts about this topic? Zeri, go ahead.
I propose we just take a vote at some point, maybe not tonight. We could think about it for the next meeting, because I'm also in the same boat. I mean, I feel like, you know, if you have a set goals, we can achieve them within the time frames that we have, whether it's 10, 11, or 12. I think, you know, knowing what the goals are, we can kind of figure out what we need to do within that frame of time. But August, I think with respect to some of us that have children, families, vacation time, it would be nice to have that flexibility. I know I certainly don't want to miss any meetings, but at the same time, I would appreciate that flexibility of having at least 1 month, whether it's I'm thinking August or December when it's near the holidays, but either one of those.
This is Wes. Thanks, Zeri. Appreciate that. Yeah, I agree. I think that either August or December, I guess what we can do is what Zeri suggested. Let folks think about it, and we can revisit this question in June. We'll add that to the agenda. Does that work for everybody? We'll have a vote in June. Okay. All right. There was one other item for new business. Some of you had mentioned working on goals, which Charlie has just brought up again. And I proposed last month that we establish a subcommittee to work on this topic. So what I will do is over the next few weeks, I will send the board members a poll and see who's interested in joining the subcommittee to work on these goals. And when I collect the data, the names and how many folks are interested, then hopefully we'll be able to start that subcommittee up next month. Okay. I believe, also someone just typed something in the chat that I missed, so let me go back and look at that.
An announcement from Jerry.
Oh, an announcement. Oh, great. Okay. Okay. So there's an event tomorrow, part of BCIL, Boston Center for Independent Living, and the anniversary. There is a panel discussion, a virtual panel discussion. Wait, I'm having trouble seeing it. Hang on 1 second. Virtual panel discussion wins. Yeah, Boston Center for Independent Living 50th anniversary. Okay, thanks Jerry for that. Any other new business from the board members that we'd like to discuss? Olivia, go ahead.
This is Olivia. I wanted to put on people's radar that we're actually right now in the housing bond bill season for Massachusetts to fund affordable housing through the next few years. One of the things that's been brought up is estate recovery for people on Mass Health who receive benefits through the PCA program or other Mass Health benefits when you pass away if you have a house. If you own significant property, like stocks, bonds, whatever, Mass Health comes in and takes that as kind of a repayment for keeping you alive throughout your time with disability. It's disgusting. It needs to end. And there's a bill that is being proposed in the memory of Joe Tringali from Western Massachusetts to end state recovery from SL. I think it's something that if it comes up at the state level, we should support it.
This is Wes. Thank you, Olivia, for bringing up this bill. Very important. I actually was not aware of it at all, so I appreciate it being brought to our attention. If you can find out what Senate and House bill numbers those are, please send that to the board. That would be really helpful, so we're clear on which bills especially that we're following. And then we can take a look at them, read through the language, and form opinions.
Excellent.
Particularly to support from the board's perspective.
Will do.
Okay, great. Any other new business? Okay. Pages, 1 second. All right, so this is the portion of our evening, our public meeting, where we offer space for public comment. Are there any members of the public here tonight who would like to make a public comment? Please introduce yourself, wait to be given the ability to unmute, and then you have 2 minutes to make your comment or ask your question. Okay, this is Wes. Jerry, your mic turned on. Did you have something to add? Oh.
No. Trigger finger.
No problem. Okay. The next item on our agenda is to adjourn this meeting. So I would need someone to make a motion in that direction.
This is Jerry. I move to adjourn the meeting.
Thank you very much, Jerry. Do we have a second?
I'll second that.
Terrific. Thank you very much. Wait, who just seconded it? Was it Zeri?
Yes.
Zeri, terrific. Thank you. I just didn't see who'd done that. I appreciate that. All in favor of adjourning this meeting, please raise your hand or say aye to signify.
Aye.
All right. This meeting is adjourned at 7:05 p.m. Go Seas. Go Celtics. Have a good night, everybody.